Welcome to section 9.4 on synovial joints. First, we're going to start off by describing some distinguishing features and anatomy of synovial joints. We'll see that our bones are finally separated now by a joint cavity. Remember, anytime you see that word cavity, you want to think of a space. So we do have space in here, and this is going to be included in most of our joints throughout our body. We'll classify our synovial joints as diarthroses because all of these joints are going to be freely movable or mobile. And all of these basic features will be found in a synovial joint. So first, we'll always find an articular capsule, which you can see along the outside of this joint, and a joint cavity, that space found in between the bones. We'll also find some synovial fluid, which isn't really pictured in here, but imagine it fills in this cavity space. And each of the bones should have articular cartilage along the ends of them. And this is made up of hyaline cartilage here. We'll also find ligaments that would help to stabilize the joint. So sometimes these are found on the outside of that capsule, so we would call these extracapsular ligaments, and sometimes we'll find them inside, so we would call those intracapsular ligaments. We'll also find nerves and blood vessels around this region in order to give nourishment and supply. So now let's take a look at that articular capsule. The articular capsule is made up of two layers. It's also known as a joint capsule. So let's take a look at the outer fibrous layer first. It's out over here. This is made up of a dense connective tissue, and it helps to strengthen the joint to prevent the bones from being pulled apart. If you look on the inside, we have this inner synovial membrane, and this is mostly made up of a loose areolar connective tissue, and it covers the internal portion of the joint. So I always think of it as a little outline on the periphery of our joint cavity. And it is going to be the one to produce synovial fluid. So it just kind of flows on in from that membrane. Now if we look at this articular cartilage once again, like I said before, it's made up of hyaline cartilage, and we find it at the end of our two bony ends. And its function is to reduce friction while we move. It also cushions our joint and absorbs joint compression and will prevent damage to the articulating ends of these bones. We'll see that this cartilage in particular will lack a perichondrium. Remember that perichondrium was found on the outer side of cartilage. And it's also avascular, meaning we're not going to have any blood vessels in here. While our bony tissue over here, this is very vascular. So the nutrients kind of diffuse in to our articular cartilage so that it receives nourishment. Now for our joint cavity, that space we find within our joint. This is going to be lined with that synovial membrane that we discussed that produces the synovial fluid. And if we look at the synovial fluid itself, this is our normal version of synovial fluid, where we're going to get like a clear amber color to it, and it's very viscous and type of oily substance. Somebody once described the viscosity of the synovial joint, and I have to agree, because as we've opened some knees and cadavers, we've been able to see some synovial fluid in there, and its viscosity is about the same as if you were to take ice and slide it across ice, if that helps at all to kind of get an idea of that. So what this synovial fluid does is it helps to lubricate the articular cartilage here on our articulating surfaces, and it also nourishes the chondrocytes, the cartilage cells that we're going to find here in the hyaline cartilage, and it'll act as a shock absorber as well. Now for our ligaments. These are going to be made up of dense regular connective tissue, and they help to connect bone to bone. They'll help to stabilize and strengthen and reinforce our synovial joints. And like I said, when we find our ligaments on the outside of our capsule, this is going to be called an extrinsic ligament or an extracapsular ligament. So again, out on the outside of that articular capsule or joint capsule. Whereas our intrinsic ligaments that we find, they're found within the joint itself. So it's usually going to be a thickening of the articular capsule itself and will include ligaments outside and within the articular capsule. And now for our sensory receptors and blood vessels. This is numerous within our synovial joints. You could see some of our stretch receptors and the nociceptors, which are pain receptors in here, to detect painful stimuli and report on the movement that's happening within a joint. And if we are having too much stretch going on, maybe it reports that all back to our central nervous system. Sometimes around a joint we'll also have tendons. These are composed of dense regular connective tissue as well, but it's not a part of our synovial joint. Instead, we'll see that it's connected to a muscle, to a bone, whereas a ligament is bone to bone. And these tendons can help stabilize joints. We'll see a lot of muscles crossing joints in order to perform movements. So in doing that, we're also stabilizing the joint. And now for a fun word here, bursa or bursae. Bursa singular, bursae is plural. This is a fibrous little sac that's going to contain synovial fluid. And the way I always remember this is bursa refers to purse in Greek, but I speak Armenian and the word baisag means purse in Armenian, so I just refer to this as like the little purse. That's how I remember it. And it's going to be lined by a synovial membrane, so we will find some fluid within here, and we're going to find it in several synovial joints where we have areas of bones, ligaments, muscles, skin, or tendons that are rubbing together. So you can see some of these dispersed throughout the knee joint here, and they'll also be connected to or separate from the joint cavity. So you can see this really well with this prepatellar bursa between the skin and the patellar bone. And its job is to alleviate friction. So in these areas where we would have some high friction going on, that's where you're going to find them. And we also have a, I would say, variation of a bursa that is known as a tendon sheath. So it's just an elongated bursa that's wrapping around the tendons where friction is typically extensive, like in the area of our digits. These tendons that belong to our flexor digitorum superficialis or flexor digitorum profundus, and if we break those names down, flexor means it's going to flex, digitorum is referring to digits 2 through 5, and superficialis just means that one is superficial, profundus means one is deep. So you can see 8 tendons right in here, in which are going to go to our fingers, and there's going to be a lot of friction there, especially because some of these tendons overlie others. And so these tendon sheaths are really helpful, and we're going to find them in areas of the wrist like we see here, or in the ankle. And sometimes we have fat pads. These fat pads are going to act as protective packing material in our joint periphery. And we have one in the knee here, just below the patella. And this fills in the space where when a joint shape is going to change. That patella is going to move around as we flex and extend our leg, so that fat pad will be very useful there in the changing of the shape of our knee joint. Okay, now we're going to go through and talk about some classifications of our synovial joints. They'll be classified by the movements allowed and the shapes of the joint surfaces. So first, let's talk about the classification of movement. First, we have uniaxial joints. So uni, you can think of one type of movement within an axis. So these are bones that are just moving in one plane. So the best example of this are our plane joints, in which we have those flat surfaces of our carpals kind of moving and gliding across one another. And another one would be over here between our ulna and our radius. Next we have biaxial joints, bi meaning two, so now we're going to have movement in two planes or two axes. So examples of this, sorry about my dog barking. Examples of this would be, actually I'm going to point it out over here because it's a little bit easier to see, where we would have that gliding movement take place, and also we can do things like opposition of the thumb, which we will talk about a little bit later in this chapter. And then we have multi-axial joints, where we're going to have bones move in multiple planes. The best example of this is in our shoulder, because we can do things like rotation, flexion, extension, abduction, and adduction. Now let's talk about classification based on the shape of our joint surfaces, and we're going to list these from the least mobile to the most freely mobile. So we'll start off with our plane joints. Our plane joints have an articular surface that is flat. So here's a literal illustration of that, and it is the simplest, least mobile synovial articulation that we can have. We mentioned that this is uniaxial, meaning that we're limited. We can just really move this from side to side or have a gliding movement in a single plane. Next, we have our hinge joint, and our example of this is the humerus coming into contact with the ulna, the trochlear notch to be specific, and we'll see that we have a convex surface, which would be our trochlea of the humerus, or represented by this illustration, that would fit within a concave depression. So that would be that trochlear notch of the ulna. And this would also be uniaxial, kind of like a hinge on a door. We would only have movement in one plane. So this would be flexion and extension at the elbow joint. And then we have our pivot joint. This is when we have a bone that it has a rounded surface. So this would be like the head of our radius that would fit into a ligament ring. So that would be this radial notch of the ulna that we would have placed here. And this too is a uniaxial joint, where we just have rotation on that longitudinal axis. Our condylar joint will have a oval convex surface that'll articulate with a concave surface. So an example of this would be at this head of the metacarpal that makes contact with our proximal phalanx. And this would be biaxial, because we would be able to flex and extend and abduct and adduct. All right, our fifth joint classification for synovial joints is a saddle joint. And this is when we are going to have a convex and concave surface that resembles a saddle-like shape. And the best example of this would be here between our carpals and our metacarpal. So this would be our carpo-metacarpal joint. And this is biaxial as well, because we would be able to flex, extend, abduct, and adduct. And then lastly, we have our ball and socket joint. We've got a spherical head on one of our bones that would fit into a cup-like socket on the other. Our example of this would be the shoulder, or maybe this reminded you of the head of the femur and the acetabulum in the hip. That also is a ball and socket joint, and we would classify this as being multi-axial because we're able to have movement in 3 planes. We can flex, extend, abduct and adduct, and have rotation. And this is the most freely movable type of joint we have in our body.